In this module, we will explore some key principles of teaching and learning POCUS, including the importance of personalized teaching tailored to meet diverse student needs, feedback, which is essential for the student's growth and improvement, active learning, which engages students in the process, relevant content, which connects students to real-world applications, and fair, accessible, inclusive, and respectful practices. Instructors must know their students well. They must understand their clinical needs and motivations for learning POCUS, and they must align their teaching with students' goals to enhance engagement. Student-centered learning strategies shift the focus of an activity from the teacher to the students. These types of approaches emphasize students' interests, abilities, and learning styles. The teacher enables students themselves to take an active part in deciding what they learn, how they learn, and how they can evaluate what they have learnt. The aim is for students to take more responsibility for their learning and own it, rather than just sitting and waiting for the teacher to fill them with knowledge. Effective teaching strategies emphasize avoiding any information overload that may drown students in too much new information at one time. In the theoretical course, modular e-learning is a good way to avoid this pitfall. In the practical courses, breaking complex tasks into manageable micro-steps makes learning easier and provides immediate feedback that will enhance the learning experience. Learning is akin to scaffolding, where understanding is supported by and built upon links to existing physiological, anatomical, and physical theory. Scaffolding is a process that allows students to work in a contextualized setting and solve problems while focusing on building on associated theoretical knowledge. Consider regularly revisiting your knowledge of human anatomy to reinforce your understanding of it and bridge the gap between theoretical anatomy and how it is represented by real-time ultrasound imaging. Analyzing key events, such as in this tennis serve example, can provide valuable insights into the systematic approach needed for POCUS. Peyton's 4 steps provide a structured method for teaching skills effectively, moving from demonstration to the student's performance of them. During the demonstration, the teacher shows the skill without commentary. Deconstruction consists of breaking down the skill into a series of steps. During the formulation step, the student must describe the steps while demonstrating them. During the last step, the student performs the skill while explaining its steps. A universal vocabulary creates a standardized set of terms that can be understood by multidisciplinary practitioners, regardless of their location or training background. This ensures consistency in communication and helps to reduce misunderstandings. A consistent vocabulary enhances training programs for medical ultrasound professionals. It allows for the development of comprehensive educational materials that convey concepts effectively, leading to better learning outcomes. Transducer manipulation can be broken down into 5 basic movements: sliding, rotating, tilting, rocking, and compressing. When teaching, it can be so tempting to adjust the probe for the learner or just take over. But the best way for people to learn is by holding the probe themselves. Here are some ideas to avoid taking over the probe. Use standardized terminology. If that's not working, use your cell phone or similar object to mirror the probe's direction and model the adjustments needed. If that's not working, ask if you can put your hand over the learner's hand to move the probe. When making ultrasound scans in the sagittal plane, the images obtained by radiologists and cardiologists mirror one another. To avoid changing the position of the indicator on the screen, intensivists and emergency physicians usually choose the cardiologist's convention. This makes sense because the heart's anatomy is more complex than that of the other organs. To ensure a good image, the probe must be held correctly. Using a tripod grip minimizes shaking and unwanted movements. It helps the sonographer create a stable base that allows the gentle application of pressure while scanning. When reporting on a POCUS ultrasonography examination, using a limited vocabulary is important for several reasons. A concise vocabulary helps to ensure that the report is clear and easily understandable for all the healthcare professionals involved in the patient's care. This minimizes the risk of misinterpretation. A restricted vocabulary helps to emphasize the examination's most relevant findings, which aids in prioritizing patient treatment and management decisions. A limited vocabulary enables quicker communication and documentation, saving time for both the clinician and the later reader. This is especially crucial in emergency situations, where rapid decision-making is essential. Simplifying language reduces the reader's cognitive load, allowing them to focus on the clinical implications of the findings rather than deciphering complex terminology. Overall, using a limited vocabulary enhances communication, promotes effective patient care, and supports better clinical outcomes. Here is a table with the terminology we use in the basic course. Providing details about image quality is crucial to maintaining good medical records. It helps to ensure that the examination adhered to standardized protocols and that any challenges to visualization are noted. Descriptions of an examination's echogenic and anatomical quality provide the necessary context with which to assess the reliability of the findings. Knowing the image quality tells us how much confidence we can place in the results or whether further imaging might be needed. A comprehensive report, including both echographic and anatomical descriptions of the imaging, enhances communication between the operator and other physicians reading their report. Knowing the strengths or limitations of the imaging performed can guide further diagnostic or therapeutic steps. Consistent descriptions of image quality help us toward the standardization of POCUS practices, which is important for maintaining high standards of care across different settings. By noting limitations to image quality, the clinicians interpreting them can help other healthcare professionals understand the reliability of their findings. This transparency is essential for guiding further evaluations or treatments. Echogenic quality can be described as good, medium, or poor. Anatomical quality can be described as good, acceptable, or insufficient. Documenting this information can contribute to collaborative learning among healthcare professionals, especially in teaching environments where emerging ultrasound practitioners are learning from the documentation practices of more experienced clinicians. Expressing a degree of confidence in the diagnosis derived from POCUS ultrasonography is important for several reasons. It helps convey the reliability of the ultrasound findings to other clinicians. A clear indication of the degree of confidence in the examination's findings can influence how much weight is given to the diagnosis, guiding further clinical actions. A high degree of confidence might support immediate treatment decisions, whereas a low degree of confidence could suggest the need for additional tests or evaluations. Understanding the degree of confidence can help to evaluate the risks associated with a diagnosis. This is particularly important in critical care or emergency settings, where timely and accurate decisions are vital. It also helps to ensure that all the team members have a shared understanding of the findings and their implications. In summary, expressing a degree of confidence in a POCUS report enhances the reliability of the diagnosis, supports informed clinical decisions, and contributes to effective communication and patient management. This slide matches strong, medium, and weak degrees of confidence in a diagnosis of severe left ventricular systolic dysfunction to the interpretations that could be made from their respective ultrasound images. This slide presents a competency-based assessment tool for ultrasonography with which teachers can evaluate a student's participation in a course or their performance of bedside examinations. It comprises 4 domains: preparation, image acquisition, image optimization, and clinical integration. Each domain is assessed on a 3-point scale, describing the student's level of competence in the performance of some, most, or all of the elements comprising that domain. This tool can be used to simplify or facilitate training feedback. Transmit these tips to future ultrasound operators and beginners in POCUS. Master anatomy and physics. Reinforce your knowledge regularly. Familiarize yourself with the equipment. Seek a mentor. Collaborate to grow. Use a standardized approach following systematic procedures. These tips are crucial for success. It's essential to remember that mistakes are an inevitable part of any learning process. Instead of being discouraged by them, use them as invaluable stepping stones towards growing your skills in point-of-care ultrasonography. We frequently hear back from students and teachers that as they improve their skills, POCUS becomes more and more fun and engaging. Think back to when you were a beginner in this field. There were probably times when you felt frustrated, disheartened, or confused. Use teaching as an opportunity to transmit your passion for POCUS, to engage with your students, and to draw out their natural curiosity. You'll help your students to see POCUS as an incredible tool for exploring the human anatomy and connecting with patients in a whole new way.